If you have some post-op bleeding, you can refer to your post-op sheet that we sent home with you. Here's a diagram that outlines where you are most likely to have bleeding. If you look at this patient, he's bleeding from the back portion of the incision on the roof of his mouth. So we're going to take a piece of gauze and place it firmly onto the area and then squeeze with our finger and our thumb to create pressure to stop the bleeding. Typically it bleeds from the back of the incision, but it might bleed from the front. If you notice that the gauze is filling up, you can switch it out. Take another piece of gauze and put firm pressure, and usually this will help to stop the bleeding within a couple of minutes. Okay, so if you're having some bleeding, I want to talk about where we take the tissue from on the roof of your mouth. These are your molars in the back. This is a model of the roof of your mouth. Usually we take the tissue from right next to the molars in the back, right here. So when you have your bleeding, take a look in the mirror, and then you can get some gauze. This is the 2x2 gauze that we send you home with. It looks like this. You can fold it in half, and you're going to want to place the gauze on top of the incision right next to where those molars are. You're going to take your finger and then your thumb and squeeze like this. Pinch onto the spot that's bleeding and then watch to see if it goes away. If the bleeding stops, then you're doing a great job. If you're having continued bleeding, it might be that the incision is bleeding from somewhere else. So place your gauze on to the incision and then push your finger on a different spot on the incision and squeeze hard.